My PRI journey has really been an investigation into how my face, as a youngster, got so asymmetrical so early that lasted through my teenage years, through my young adult years, into my mid-30s. And now, over the past really 10 years, but mostly over the past 4, when I became aware of cranial issues, how my face has started to rearrange itself once it got the appropriate sensory inputs. Now, when I'm speaking with Dr. Marielly Mitchell, she's from Los Angeles, that'll be the second half of the video, the conversation that we're having is about the oral cavity, and she explains it really well. So you should definitely stick around after I have this introduction for that interview, because everything that happens when you're younger will affect you as you get older. Children need to have appropriate oral cavity and facial cranial expansion. And she talks about what happens when that does not occur and why that's not occurring at an alarming rate at this point in time. Children we're being born with smaller and smaller, or we're developing with smaller and smaller palates and craniums and longer faces. And that creates problems down the road, and then people have to see postural restorationist therapists to try to help them undo these issues. And the pictures of my face are showing what really does occur when facial development and oral cavity development does not take place appropriately. From a movement perspective, the biggest problem is when you have these facial asymmetries, it will affect how your cranium sits on top of your neck. And what you're going to find is one side of the head goes up while the other one goes down, and you get stuck in that position, and we call that the right TMCC pattern. When you see this right TMCC pattern and these asymmetries, it's very, very predictable. That's why the first thing I look for when a client comes to see me is their face, because it tells me a lot. I kind of know what I'm going to get. It's also why when I work with people online, the majority of my questionnaire actually deals with vision and the oral cavity. And I tell people pretty quickly, look, I'm not going to be able to help because you're going to probably need someone who can assess you live. It's that important. It's really the whole thing. Up here regulates down there. And if up here is not functioning properly, the lower body, you can do every PRI technique in the book and it may not work. Now, that's not everybody. That's probably 80, maybe 20% of PRI clients, patients are going to fall into cranial issues. That's not everybody, so don't assume that that is you. If you're not having success, you just need somebody to help you, most likely. But what does happen when you have a head that's sitting inappropriately on top of a neck, on top of the cervical spine, it's going to limit your ability to rotate your body, which means you're going to lose your frontal plane and your transverse planes. And the tension is going to be in the neck, which then spreads down to the rest of the body and extends your body. And now when you have an extended body, you can't move properly. And it's the compensations, the behavioral changes that have to occur that starts to cause the pain that people then experience. But the lower body is really not the issue in these cases. In these cases, the lower body is not functioning, and I mean lower body from the neck down, is not functioning because of what's going on in the cranium. And again, I'm a perfect example of that. All the pain that I had, the SI joint issues, the neck spasms, the generalized back pain, the knee pain, the hip pain, the shin splints, the plantar fasciitis, tinnitus, everything I dealt with had nothing to do with the body itself, the physical body. That wasn't the issue. It was all coming from here. And as my face has straightened out, and you can see my face, hopefully you can see my face has straightened out over the past couple of years through visual integration, dental integration, and even having to get orthotics for my shoes, all of that started to straighten out my body. But the cranium had to straighten out before I could really get my body functioning the way it should be functioning. So I've been reading a great book called The Rise of the Mammals. And there's one particular chapter that this paleontologist, he is describing the importance of the human jaw. And in reality, mammals are differentiated from non-mammals by our jaw. So there's a couple of points of emphasis and why this all ties together with postural restoration in the rest of your body and good oral facial development. Number one, non-mammals, their jaw, so we have one jawbone. This is the mandible. I think they call it the dental bone. But anyway, non-mammals, it's split into multiple bones. It's usually 4 bones. Actually, it's 4 or 5 bones. Now, in mammals, it became 1 bone. And where did the other bones go? The inner ear. So your vestibular system, those 3 ossicles, the inner ear bones, are directly connected embryologically and evolutionarily to the jaw. So when jaws are not positioned properly, or not moving properly. That will affect your inner ear and your vestibular system and your upright balance, which of course includes your visual system and your ankles and feet and how your brain is perceiving the ground underneath. So that's the number one, that's the big issue, is the human jaw became one bone and the other bones became the inner ear. Not only that, the one big jaw muscle became three muscles. So instead of having one jaw muscle, one, I guess, temporalis muscle, it now became the temporalis muscle, the masseter muscle, and the pterygoid muscle, and which is, well, actually you can see it right there. They're back in this area on both sides. Those three muscles provide the most important movement in the human body that makes us human, and that is lateral trusive movements. Our jaw can move forward and to the side, and this provides for more efficient chewing. That movement has to occur for normal neurological function. When you have jaws that are stuck in one position off to the side and you can't get that normal lateral trusive movements, it means you're not making proper contacts with your molars and your canines. That's why my canine does not touch my other, and that's a problem. So without normal, and there's so many studies linking chewing to neurology and cognition, brain function, and it's all there as a mammal. He also points out, the author of the book also points out, that our bigger brains came with this ability for the jaws to move. It also involves the growth of the neocortex, more calories, more efficient digestion, because now the teeth have a partner underneath, rather than, so you have a top molar and a bottom molar, and they make contact and they smush and they grind food down into a bulbous, and then you swallow it. It's more efficient. They no longer, it's not like alligator teeth where they do this, where they interdigitate. And in those jaws, they only do this. Watch a dog chew. They don't have this type of efficient chewing. They just do this. So all of this stuff came together. Our ability to plan, you could call it abstract planning, the frontal lobes, the neocortex, the subjunctive, grammar, the ability to plan in the future of what might happen. That's a good thing, but it also gives us anxiety. That's why other animals don't have anxiety, because they can't plan for the future because they can't imagine it. So all of this is coming at the same time in our evolutionary history. So oral cranial health and development is of utmost importance for us to function as humans. PRI will work beautifully for the lower body when up here is working as it should. When up here is not working as it should, because maybe as a young child you didn't develop, and a lot of young children are not developing properly these days, everything is compromised. Your athletic career is compromised. Your ability to sing, to speak, to swallow, to throw, to think normally is compromised when up here is not working. And in the scientific literature, there are a number of studies, and I'm going to put a link to one of the studies, which is an overview. I'll put it in the description of the video. But what you do find is that there are studies. It's out there, but of course, do optometrists and dentists actually get together and discuss these things? No, of course they don't. But what you'll find is a connection between malocclusion, poor teeth touching, how they touch, malocclusion, and refractive errors in terms of myopia, hyperopia, astigmatisms. Mandibular deviations, so when a jaw is off to one side or the other, mandibular deviations and refraction errors. And then also mixed dominance. So when humans should be lateralized over to the right side, right eye, right ear, right arm, right leg. That's normal. That's normal lateralization. I, on the other hand, have a very dominant left eye, probably a dominant left ear, but I'm right-handed and right-footed, so there's a mixed dominance. And what they find in the studies is that people with mixed dominance often have more instances of crossbites, which is a form of malocclusion. So if mixed dominance could lead to a crossbite, which will then lead to refractive errors. I had all of that, and my PRI journey is to try to correct all of this, and the oral cavity is a big part, but you can't separate the oral cavity from the visual system, and you can't separate those from your brain's sense of the ground, so your feet. I also have very high arches and a high palate. Do you think that's coincidental? I do not. So here's the rest of the interview with Dr. Marielly Mitchell. If you enjoy this video, could you please like it, share it, subscribe to the channel? I'd appreciate it. I've mentioned that many times on my own channel. if you are mouth breathing, your neck is going to be tight. It's in the literature. That's not a PRI concept. It's in the, you're going to use your neck muscles to breathe. And once you're using your neck, it's going to pull your chest into extension. It's going to pull your head forward. You're going to have forward head posture, at least to some degree. You might not lose your cervical curve completely, but once you're there, if you cannot, so someone cannot do a PRI program if they cannot breathe through their nose. It's as simple as that. So that's on my questionnaire. Can you breathe through your nose? I mean, if they can't breathe through their nose, they're going to mouth breathe and they're going to be pulled into extension and nothing's going to help them. So, and that is a huge, the ability to get people to breathe, and a lot of people just breathe through their mouth because they never really think about it. It's not that they can't breathe through their nose. They just, for some reason, started breathing through their mouth. And yeah, and that's just what they do. And now it causes dental issues and occlusion issues. And then once you have occlusion issues, jaws can start to shift, and now you end up in my land, like the types of things that occur with me, and you don't want to be there. So I'm trying to get people to realize that the neck will be affected by all of these oral habits, even if you don't understand exactly what you are talking about. If anyone watching this doesn't understand all of everything else we just said, but let's talk about the oral cavity and the influence. And I've said this so many times, the jaw is enmeshed in neck muscle. If jaws are not moving properly, if they're too far back and they're choking you, or open bites occur because you're tongue thrusting, and now you have, I haven't had if someone comes to me and they're in pain and they have an open bite, I have not been able to help this individual until they have some sort of dental intervention. I can't even get them neutral unless I somehow make tongue depressor between their teeth, cheap plastic mouth guard, something that will take away that open bite. Their body will relax, but the moment their teeth touch again, they're back into the pattern. So why don't you discuss the oral cavity and its impact, and which is a really large subject.
You're really to start.
Yes. So let's talk about the tongue first. And
okay.
Yeah, let's talk about, okay, so what is the most common pediatric issue that you see? And you can start with that.
Okay, so to also just to make it kind of full circle to what you're talking about, people are mouth breathing, they don't even know why. People are mouth breathing because of the social this epidemic that we're in that starts in the pediatric world. People are from a generation, especially the ones who are older, in your 40s and your 30s and your 20s, also likely there's a generation of families now that are kind of getting with it because of the James Nestor book Breath. Because of this excessive use of pacifiers and bottles in infancy and in toddlerhood and sippy cups, it's narrowing the palate. And so what happens is people basically have a high vaulted, narrow palate, right? Which then creates a too narrow of a space for the tongue to come up and have the place where it needs to go. The tongue is supposed to be pushing up against the palate all the time, like that, to give it deep proprioceptive input to your palate, where you have a ton of nerves, right? You have your nasopalatine nerve, you have a bunch of other nerves there that help calm the nervous system so that you can keep your mandible closed with your maxilla and actually keep your mouth closed and just breathe through your mouth. And so what I see most common in the pediatric world is I have infants, I work with babies as young as 6 days old, with kids to 26, right? And I see adults too, but just not all the time. And these babies are born mouth breathers for whatever reason, or they were using bottles or pacifiers for an extended period of time up until 3 months, 4 months, 5, 6, whatever. And they're mouth breathing all the time. And then as soon as someone goes to feed them, their mouth is full and they're like, I can't breathe. And so the babies are pulling on and off the breast, they're pulling on and off the bottle, they're gasping for air, they're getting reflux, they're getting into this vicious cycle of aerophagia and swallowing all this air. There's milk spilling everywhere and their feeding skills are really poor. And then they also create these oral habits that are really poor, and their tongue is being pushed down with all this negative pressure from the bottle. And fed is best for sure, 100%. But if you can breastfeed, it's optimal because the woman's breast tissue smashes up against the palate and widens it so that the child can actually have a place to rest their tongue, and the tongue can do the motion that it needs to do in order to raise up against the palate and widen everything, and then co-contract to elevate. If you think of indigenous cultures, they all breastfeed and they all have their wisdom teeth. They don't wear braces. They have pearly white teeth, and their mandible and maxilla are really well developed. And more than anything, what happens is when this is actually really well developed, the airway is more painted and it's wider, because if your jaw recedes, your airway back here is going to get more narrow and pushed back.
I need your models, by the way. I
love him. He's the best. He's so good. I mean, that's another thing is like, people don't realize like your tongue is like, all we ever see is this, but like, it's all this.
Yeah.
Right. And like, if you're not elevating that, that's how you get like a double chin and like these like turkey necks. Is like really like, it's just the problem with this part of the body. It's like a blessing and a curse. It gives you a lot of mobility, but it's all soft tissue. Yeah. So if it's not co-contracting and if it's not like structurally sound, the sensitivity of your airway being there is a massive issue. And then that's when the sleep issues happen. So then my babies who are mouth breathers turn into toddlers who are mouth breathers, and they're getting their tonsils out at like 2, 3, 4. And they have to, because these kids literally basically are on the borderline of having sleep apnea, and they're having major behavioral issues. There's studies coming out now that they're like doing rapid palatal expansion and things like that to make room for the adenoids, which is amazing. But like qualitatively, that doesn't always like come fast enough for some of these kids who are having major issues and are missing out on massive amounts of time when 80% of their brain is being developed under the age of 3. That's a huge issue, and people don't realize that. So and then their needs go like insanely intense. That's the problem. Kids like they're like grasping at straws to regulate themselves, like scaling walls, putting everything in their mouth, and just like they're like wild because they're so dysregulated, because they're not breathing well and sleeping well, and their sensory profile just goes like haywire. Does that make sense?
Well, yeah, and the regulation, all right, God, there's so many different ways I can go, but we don't have tons of time. All right, how do I want to
do it again?
Okay, the issue of, oh, no, I'm sorry. The ones who are having their tonsils taken out at a really early age, so is this because of non-breastfeeding? Is it because of genetics? Is it because of what else? How are these people getting so narrow?
A lot of them are using pacifiers and bottles and sippy cups for an extended period of time. Their thumbs, they're typically also maybe sucking on their thumbs, sucking on their fingers, all that kind of stuff. They're just having they're like literally when you're born, you're just a glob of Play-Doh. So anything you put in the mouth, the child's face will form around. And so there's also genetic component to this, right? There's clients that I have, they're the perfect storm, right? Like dad had his tonsils out. Let's just say dad had his tonsils out too, like 3 rounds of braces, has a very long oval face, eyes are close together, that you can see the whites under the eyes underneath, and dad is snoring and all that kind of stuff, right? And then on top of that, then his kid also requires those types, like is also on the pacifier or bottle fed. People who have tongue ties, also the tongue cannot lift, it can't put that pressure up there, they have feeding challenges. So the baby has to be bottle fed, right? Premature babies as well, because of like the sensitivity of the nature of which they were born, they have to be bottle fed and they have to pacify on a pacifier, and that's totally fine. But the ripple effect of that is you get a narrow palate and you get a mandible that's not fully developed, and you mouth breathe and you literally just eat germs all day, and then you have enlarged adenoids at first, and then you get enlarged tonsils. So it's either one of those factors, it's all of those factors. It really just like depends. Also, like babies who just eat solely like purees for an extended period of time, or just suck on those pouches for a long time, use the pouches when you need to, when you're traveling, whatever. Like I don't want parents to stress out, but they need to chew. Like kids need to chew. Like our jaws, which are receding at such a rate that our skulls are shrinking, like at the fastest since the Industrial Revolution. It's kind of a thing, right? Like we're de-evolutionizing as a like species. And it's because of what we're using and what we're doing to this craniofacial area of our body. And what people don't realize is that it impacts your airway, which impacts your sleep, which impacts your nervous system, which impacts everything.